Welcome to Straight from the Source, a new podcast from FMOL Health. Here, healthcare is a verb. It's how we show up every day, boldly, joyfully, and with great love. You'll hear real conversations with our real experts, the people who healthcare every day. Our goal is simple, to bring you connection, clarity, and context straight from the experts you can trust. Because healthcare isn't just something we provide, it's something we do. We're excited to kick off our first season by welcoming Kuiper, our president and CEO, to share with us about stepping into who we are as FMOL Health and our new brand campaign, This is How We Healthcare. Well, thank you, EJ, so much for being here today.
Thanks for having me.
We wanted to start with the basics. Tell us about your journey to coming to FMOL Health.
Well, it's been, almost 2 years now. Started out in healthcare as a physical therapist and worked in Florida for a number of years as a clinician, and then went back to school and got my master's and doctorate degrees in healthcare administration and physical therapy, and started leading hospitals, first on the for-profit side, and then made a jump to Franciscan healthcare about 15 years ago, and had stops in Illinois, Springfield, Illinois, worked for Hospital Sisters Health System. And then my last stop was in Omaha, Nebraska, where I served as the leader of the Midwest division for Common Spirit Health. And then joined FMOL Health about a year and a half, 2 years ago.
Well, it's been a really fun ride so far. It's been a lot of growth. It's been a lot of really kind of leaning into what makes our health system special and different. So how would you describe the mission of our system in your own words?
You know, it was really important for me that this was a system that didn't just have a nicely framed mission statement on the walls, but lived it every single day. And I would say every day that notion gets reinforced. People really join this system and stay in this system because we can make a difference in our communities every day, taking care of everybody in the community, regardless of your background, ability to pay, and especially taking care of the poor and the vulnerable. That's very important to the sisters, and it's very important to all our team members.
Well, this past fall, we announced a new way of talking about ourselves. And so we have now become FMOL Health. And that also brings about a consistent identity marker amongst our markets. Can you share a little bit about the thinking behind that decision and what that represents for the future of our health system?
Well, we have a great ministry, but we tend to have very long names, right? Our Lady of the Lake, Our Lady of Lourdes. And then if you then put Franciscan Missionaries of Our Lady in front of that, you know, in order for us to put signs on buildings, it would have to wrap all the way around the building, right?
Maybe twice.
Yeah. And so that was a little bit much. So I started a dialogue with the sisters about, you know, is there a different way of looking at the health system? We lovingly call our sisters the FMOLs, right? And so could we consider calling our health system FMOL Health, which is a little bit easier from a signage perspective and probably from a branding perspective, easier to remember. So we started that conversation probably 18 months ago, and it took a little bit for everybody to get used to the idea. And then we had our great Marcom department build a campaign, looked at some images about what it might look like on buildings, on facilities, clinics, hospitals, and then we took it to the board, the system board, and eventually to the PJP, the Sisters Board, for approval. And here we are.
Here we are. Well, and I know it was really important to you and to us that our markets remained very visible, our market names. So talk a little bit about, we call it an endorsed brand, but for those who may not be as familiar, what does that mean to you and why is that so important?
Well, I think you're absolutely right that people tend to get a connection with their local hospital. And I've seen some health systems make changes locally. As a matter of fact, we did that a few years ago, right, in Gonzales, when we walked away from our St. Elizabeth's name. And that usually doesn't go over well in the local communities, because when a baby is born in a certain facility, you immediately have a connection with that local facility and its name. Plus, we've built up 100 plus years of brand equity in those names as well, right? And so we did not want to walk away from that. We wanted to embrace it, but also at the same time send a message that there's a very strong system behind those local markets, those local facilities. And that's how we came up with the endorsed brand.
Yeah. Well, and part of this campaign and this platform, we've turned the word healthcare into a verb, kind of turned it on its head. How do you see our campaign, This Is How We Healthcare, bringing this idea to life?
Well, it's like I said a little while ago about when you walk the halls of our clinics, of our facilities, of our hospitals, you can see the mission in action every single moment you walk those hallways. And so there is something different about FMOL, the health system, and about the markets within the health system, where people think about caring for their communities a little bit differently. And so I thought it was brilliant when the marketing team came up with this verb, This Is How We Healthcare, because it is different and it sets us apart from everybody else in healthcare. And so I think it's a very effective way to communicate that our health system is a great place to come if you need to tap into healthcare when you need to be taken care of, and that we do it in a different way, in a better way.
Yeah. One of the first things you learn in your marketing courses is about differentiation and how do you differentiate yourself from your competitor. And sometimes in healthcare, that can be a little bit harder because, well, you all have good doctors, you all have good nurses, you all have somewhat good facilities. But I've realized through this brand campaign that turning our mission into an actual verb action has illuminated that differentiator for me in so many different ways. And so if you could put into words, what does set us apart? What is our differentiator? That mission we talk about, but what does that look like in Louisiana and Mississippi?
Well, first we said, when I joined the health system, is we have to make sure that we have top decile quality and patient satisfaction. You know, the best ways to measure whether a patient wants to come back or not is when they fill out the patient satisfaction card that we send out, right? And so you can't differentiate your way by being in the 60th percentile. You know, a family member cannot feel whether this is a 40th percentile facility or a 60th percentile. It's okay. It's not bad, but it's kind of mediocre, right? And so we immediately started working on getting us into the top decile, and we've made some great strides. In particular on the ambulatory side, we are now consistently in the 95th or beyond percentile, and on the acute side, in many of our markets, that's where we're heading. Same thing with quality outcomes. So that's kind of like table stakes, right? You have to do things exceptionally well. But then when you wrap the mission around that, that's when it really becomes a differentiator. It's a place of healing. And you feel that when you're in our facilities. And every team member that we invite into our family, we try to express that during the interviewing part, but also during orientation. Things are different here. 67th percentile is not good enough. You know, we want to be the best of the best in all aspects of healthcare. And I think that will eventually differentiate ourselves from other good facilities. Like you said, there are plenty of good hospitals and clinics around Louisiana and Mississippi, the Gulf South, but not great facilities. Those are within our family.
You've really challenged the teams and our leaders to look beyond good enough. How do you keep people motivated? How do you keep the team looking toward that goal and really wanting to show up every day better than they were yesterday?
Yeah, it's a never-ending journey. We use the mountain climbing analogy, and obviously the ultimate goal when you're a mountaineer is to summit. But like I've told people, you know, once we climb this mountain, you know, once you're at the summit, you actually see another mountain on the horizon, right? And we're going to keep climbing until we are in the 99th percentile, which is the best in the database. I would like for people to travel to Baton Rouge, to Lafayette, to Monroe, to Jackson, all the towns in between, to come see what's so different at FMOL Health. What are we doing differently that differentiates us from everybody that's also in the healthcare space. And it's going to take us a while to get to that point, but we're well on our way. We've made some incredible strides. And the one that I'm really, really proud of is that we're now in the 95th percentile in the Gallup database for employee engagement. I firmly believe that when we invest in our employees, in our leaders, that patient satisfaction and quality and ultimately financials will follow. But you have to start with taking care of your people, because those are the people that directly or indirectly take care of the patients. And so I think the fact that we're now in the 95th percentile bodes very well for great results down the line.
Yeah, because you hear a lot of leaders who'll come in and say, our bottom line, and we have to make this much profit, or we have to do this. You've kind of flipped that, and our organization has flipped that to focus on the people that will then do great work, and the good will follow. Right. The great will follow.
Absolutely. And it is following as we speak. I think your workplace has to be a safe and secure place. And I think what's happened inside and outside of healthcare, because of all the financial pressures, that leaders tend to focus on the financial bottom line before anything else. And if you do that, you're going to start losing your people somewhere along the way, and you're going to start getting disconnected with your mission. So financials, very important, but a lagging indicator. You know, I'd like to focus on the leading indicators. Our mission, all the decisions that we make should be anchored in our mission. We should reflect, and I do on a daily basis, about what the sisters started 113 years ago in Monroe, Louisiana. And what are we called to do? What are we called to be? Focus on the mission, focus on the people that actually execute the mission, and then the rest will follow.
Well, do you have a story that has really kind of touched your heart over the last 2 years or so that really shows that mission in action?
Many. Just recently I've received several emails from team members who are struggling right now financially. We had the recent government shutdown, the SNAP program that was suspended. That has real implications for many of our team members, for the community at large, but also for our team members. And I'm so proud of the mechanisms that we have in place within FMOL Health, where employees can ask for help when they can't make the rent or they can't pay for the utility bill. And we have team members rallying around that every single day. And just recently, I've seen several examples of that. It's team members taking care of team members. It's hard out there. This is a tough environment that we all live in. And when you have to make the difficult decisions of, am I going to put food on the table for my kids or buy drugs for my husband who he needs, prescriptions are very expensive, as you know. Those are heartbreaking decisions. And to see our team members rally around people that struggle is heartwarming and is part of what differentiates us, I believe.
Yeah. One of my favorite parts of our mission statement is being a healing and spiritual presence for each other and the communities we serve.
That's right. I think the team is as strong as each individual member of the team is, right? So we have to look out for each other.
Yeah. Well, part of what we want to do on this podcast is go to the source for questions and ideas about healthcare, about medicine. So kind of thinking about the future of just healthcare in general, what are some innovations or advancements that are really exciting to you?
Well, first one that comes to mind is AI, right? So we have a great IT department and a great CIO, Will Landry, who I've asked to look at all aspects of artificial intelligence and how does it apply to healthcare and FMOL Health in particular. And the way we look at innovations within our health system is we don't necessarily want to be on the bleeding edge. We want to be on the leading edge of innovation, because at the bleeding edge is where a lot of mistakes get worked out, right? So I'd rather be just 2 steps behind that to make sure that we invest in the right things. With AI, the way we look at that is how can we adopt AI, artificial intelligence, and free up time for our clinicians. We have, for example, cath labs and OR rooms that have ambient listening technology. So as the OR teams and the cath lab teams talk to each other during the procedure, artificial intelligence is listening to that and starts crafting an OR note, a post-operative note, or a post-cath lab procedure note. So by the time the clinician gets to the computer, the note is essentially drafted, and all he or she has to do, the proceduralist has to do, is edit the note. And that might save the doctor 5 minutes, 10 minutes. And that's 5 or 10 minutes that the doctor can spend with the patients versus typing a note in a computer. So that's just one of the technologies that we're looking at, that we're testing, that is very exciting to me. A lot of people look at AI and say, how can we save money? That's not how we look at AI. It's about how can we save time so we can spend even more time with our patients.
Yeah. So it's not looking at it as as an enemy, but as a tool to help us on our journeys.
And like any, innovation that comes out, you can use it for the good, or it can be used for something that could be detrimental. Obviously, we want to be a force of good.
Yeah. What other areas or initiatives within the health system are you most excited about? I know we are expanding our rural health strategy. I know we're expanding. You mentioned team member development. What else is out there that really gets you excited?
Well, several things. So we did bring in the Gallup organization to help with leadership development. We have Emerging Leadership Academy that we started last year. We have done a lot with benefits for our team members. We did a 4% across the board pay increase. We're looking at enhancing our benefit structure even more in the next cycle. All that is exciting. When it comes to rural health, there are a lot of independent rural health facilities out there that will need our help. And that help doesn't necessarily mean that we're going to bring them into our family, that we're going to quote unquote acquire those facilities. But we are trying to figure out a way how we can keep them surviving and maybe even thriving in a very challenging healthcare environment. So we're looking at extending our EPIC EHR to those facilities. Maybe we can help them bring some specialists to the community on an every other week kind of basis. So strengthening the rural health network is, I believe, a role for facilities like systems like ours that are in a good financial position, because it's important. When you have a heart attack in a town of 500 people, it is just as perhaps more life-threatening than it is when you happen to be a block away from Our Lady of the Lake in Baton Rouge, right? So it's important that we have the right resources available all across our rural healthcare network. And maybe eventually we have to bring them into one of our facilities for higher level of care, but it's those initial 5 or 10 minutes that can be a difference between saving a life or not, right?
Yeah. And it's not a space that a lot of health systems want to get into because it may not be as profitable. But one of the things that has always stood out to me is we go where the need is, and we go where we're called. And I think that's a great example of that, even in the age of you just went from AI to rural health. Like, it's crazy, the dichotomy we have to manage in healthcare.
You're right. And I love what you said about, the sisters, when they started this 113 years ago, they weren't thinking about a business plan. They were thinking about building a balance sheet or a P&L. They were thinking about where are we needed. And so we need to follow that lead, even in this day and age.
That's right. Well, what's one thing you want listeners to know about FMOL Health?
Well, if you're in the healthcare space, we have a great job for you here. We have lots and lots of job openings. We're growing very fast. And so we need a lot of people that are very talented and have an affinity for what we stand for, which is taking care of everybody in our community. Then we'd love to talk to you. It's a great health system. I had very high expectations 2 years ago when I joined the system. And all of those have been exceeded by a pretty wide margin. There are great people here that really care about what they do, and they deliver excellent care. So if anybody out there listening wants to join the team, we'd love to talk to you.
Come on over. Well, one of our personalities of our brand is joyfulness. It kind of comes from one of our core values, which is joyfulness of spirit. So tell me a little bit about what's bringing you joy these days. Doesn't have to be work related. It could be a great song, a great meal.
Well, lots of stuff. I love music. I love sports. I have to diversify a little bit when it comes to sports because I'm, obviously with our LSU partnership, I'm a pretty big LSU fan. And I've learned the painful way this past fall that you can't just, be a football fan. So I'm excited about the men's and women's basketball teams and about the gymnastics team, and baseball is coming up soon. So I have to diversify a little bit, not just put all my eggs in the football basket. But I love music. I just drove from one of our offices to this office here and listened to music on the way over.
What'd
so
you
I
listen
really
to?
enjoy. I love Van Morrison. That's one of my favorite artists, an Irish singer-songwriter. And I love Lady Gaga. So you talk about, eclectic taste. I think I'm one of those.
Well, at our last leadership assembly, your walk-up song was Metallica.
That's right. Yeah.
Tell me why you chose that song.
Well, that's Enter Sandman is a song that's being used by baseball pitchers across the MLB, and it's a song that you get pretty excited about when you hear the first minute or so. So when they asked me which walk-up song I chose for this past leadership assembly, I felt that was a pretty good one. And maybe I'll stick with it.
Maybe so.
Yeah.
Well, another thing that our brand platform really emphasizes is doing all things with great love. What's something you've seen recently that's really made you feel the heart and the love of FMOL Health?
Gosh, there's so many examples of that. What I love is, I like still rounding in the hospitals. And so we have a few in the Baton Rouge area where our corporate offices are located. So a couple of days ago, I was at a Lady of the Lake rounding, just checking in with some of our leaders. When I walk that facility, what I love is there's family members all around. There are patients kind of finding their way. Most people go to hospitals not because they want to, because they need to. And there's a little bit of angst and anxiety associated with it. And what I love is that our team members sense that and come up to those people and say, is there anything I can help you with? And usually it's just pointing out and walking them to the nearest elevator or perhaps where the cafeteria is. But just that brief moment of recognition and empathy is something that I love seeing, because that really is alive within our facilities.
Yeah. Well, is there anything else you'd like to add just to help tell the old and the new FMOL Health story?
Well, the old Franciscan missionaries of Our Lady health system was very good to begin with, right? What a wonderful legacy for over a century now. But now we're taking things from good to great, and that's such an exciting journey to be part of as a team member, but also as a community member. There are lots of volunteer opportunities. And obviously, if you're a patient or you have a family member that's a patient, I would recommend visiting one of our facilities, because you'll be very pleased with the care that you receive.
Well, thank you so much for your time. I can't wait for people to see this.
All right. Thank you.
And to all our viewers and listeners, thanks for tuning in. We'll have helpful resources linked in the show notes, and we'll be back soon with more episodes of Straight from the Source, a podcast from FMOL Health. If you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org.